Good evening all. Today our class is about femoral triangle. Our class is about femoral triangle. Most important class for 5 marks question, and this question is also frequently asked for every two papers, for every alternate two papers. And now coming to this concept of femoral triangle. See, this femoral triangle is a depression on front of thigh. Think that it is the front of thigh. It is the front of thigh. This is medial side. This is lateral side. It is the depression on the front of thigh at upper one third. At upper one third. If it is the thigh, and here is the upper one third. Here is the lower two third. So the triangle occupies at the upper one third space of the front of thigh. Next, it is occupied just below the inguinal ligament. If it is the inguinal ligament, it occupies just below the inguinal ligament. That means this is the femoral triangle. Base is at the upside and apex is at the lower side for femoral triangle. Think that it is the femoral triangle. Here the lateral side, lateral border is bounded by medial border of sartorius. It is the sartorius muscle. Sartorius muscle at lateral side, and lateral side the triangle is occupied by medial border. This is the medial border of sartorius muscle. Okay, next, medially it is bounded by medial border of adductor longus. Medially it is bounded by medial border of adductor longus muscle. This is the adductor longus muscle at medial side. Next, at the base, this is the base. At base there is inguinal ligament here, and at the apex it is formed. The apex is formed by the point where the two borders meet. That means lateral border as well as medial border is called apex. So at the apex, both these sartorius and adductor longus muscles meet. And coming to the roof means at the upper side there is a skin, superficial fascia and deep fascia. Skin, superficial fascia and deep fascia. Now coming to the floor is formed by medially by adductor longus and pectoneus. If it is the floor, it is formed medially by adductor longus. Here is the adductor longus and pectineus. Adductor longus and pectineus muscle. This is pectineus muscle. Adductor longus and pectineus muscle. And laterally it is formed by psoas major and iliacus. Psoas major and iliacus. This is iliacus. Next, this is the triangle and this is the boundaries of the triangle. We have lateral, medial, base, apex, roof and floor. We have discussed about all those boundaries here. And now coming to the contents of the triangle. Here is the lateral side. Here is the medial side. Think that it is the triangle. Think that it is the femoral triangle. Contents. This contents there is femoral artery is present in this femoral triangle. Femoral artery along with its branches. Okay, next, it traverses the triangle from where it enters into the triangle from the base at midpoint of inguinal ligament. From here it enters into the at a middle one third of this inguinal ligament. At middle part of this inguinal ligament, it enters into the femoral triangle, and in the triangle it gives off 6 branches. 3 branches are superficial branches. 3 branches are superficial branches, and 3 branches are deep branches. 3 branches are superficial branches and 3 branches are deep branches. This is about femoral artery. We will write here. First content is femoral artery. Next one is femoral vein. Femoral vein accompanies with this femoral artery. ఓకే, దట్ మీన్స్ ఇట్ కమ్స్ అకాంపైన్స్ మీన్స్ తోడుగా రావటం, అంటే ఫిమోరల్ ఆర్టరీతో కలిసి ఫిమోరల్ వెయిన్ కూడా కిందకి వస్తుంది. నెక్స్ట్ దిస్ వెయిన్ is medial to the artery. It is the medial side, this is the medial lateral side. So this femoral vein is medial to the femoral artery. That means from here is the femoral vein. Next, it receives great saphenous vein. This femoral vein receives greater saphenous vein, circumflex vein, veins corresponding to the branches of femoral artery. That means veins that related to this femoral artery will also come to this femoral vein. Next content is femoral sheath, and we will discuss clearly in the next class about the femoral sheath and femoral canal. And here is the femoral sheath. Think that it is the femoral artery and it is the femoral vein. Femoral sheath covers these two parts like this. Femoral sheath, that means simply as security guard. Femoral sheath helps to secure these two femoral artery and femoral vein. So the femoral sheath also present here like this. Okay, this is femoral sheath. Next, nerves present in this femoral artery. Next, femoral nerve. Femoral vein we have completed. Next, femoral nerve. Femoral nerve lies lateral to the femoral artery. That means here is the femoral artery. So the femoral nerve lies lateral to the femoral artery. Lateral to the femoral artery. I will wipe this femoral sheath. Here is the femoral nerve. That means lateral to this femoral artery. And it is just outside the femoral sheath. It is just outside the femoral sheath. This is the femoral sheath. It lies outside the femoral sheath. Next, this is femoral nerve and the nerve to pectineous muscle. One more nerve that enters into this femoral triangle that supplies the nerve to pectineous. Pectineous is at the medial surface. So pectineous nerve. Next, femoral branches of genitofemoral nerve. Genitofemoral nerve is present here. Genitofemoral nerve. Next, lateral cutaneous nerve of thigh. Next one is lateral cutaneous nerve of thigh. This cutaneous nerve supplies to the skin of the thigh. This cutaneous nerve supplies to the skin of the thigh and it crosses lateral angle of triangle. It runs on the lateral side of thigh. And it supplies, this nerve supplies to the anterior lateral aspect of front of thigh. Anterior side as well as lateral side. So anterior lateral aspect, and that means this part, ante this part. Ee lateral at the same time anterior side lo unna part ki if lateral cutaneous nerve ani supply chestadi. Next, and a lateral aspect of gluteal region also. It supplies to the gluteal region also of lateral aspect. Next, fifth nerve is deep inguinal lymph nodes. Fifth one is deep inguinal lymph nodes. These deep inguinal lymph nodes lies in the deep fascia of this triangle. This lies medial to the upper part of femoral vein and receives lymph. This lie medial to upper part of femoral vein. That means this is the femoral vein. It lies at the medial side of. That means if it is the femoral vein, it lies medial side of femoral vein. That too at the upper part. That means here. It lies at the upper part of the femoral vein, lateral to this, medial to this femoral vein. And this is lymph from superficial inguinal lymph nodes, from glans penis or clitoris, and deep lymphatics of lower limb. It receives lymph from deep lymphatics of lower limb as well as glans penis. That means here is the glans penis and here is the clitoris, as well as superficial inguinal lymph nodes. These are the lymph nodes that deep inguinal lymph node receives. Okay, I repeat again: femoral nerve to pectineous, femoral branch of genitofemoral nerve, lateral cutaneous nerve of thigh, as well as deep inguinal lymph nodes. Femoral sheath, femoral artery, and femoral nerve, and femoral vein. These are the contents that present in this femoral triangle. Thank you all.